Thanks for tuning in tonight. It's a beautiful night. We got a good conversation here. Um, I did a I did have a couple conversations with my coworkers and my doctor about this earlier, and I took some notes. They had some good things to say about this. So this is episode 11. We're gonna be talking about bad habits as a dental assistant. Um, My name's Trinidad Mora. As you know, I'm the dental advocate. Where the dental assistant. Um, oh, I'm gonna skip that. All right, guys. So let's talk about a little bit about some bad habits. You know, um, I think in dentistry, as an assistant, sometimes we get so used to doing something a certain way, and we own it. Actually, we call it our way. Whether we come from another office, or whether someone's teaching you something and you push a little bit because you say that's not the way you like to do it. In dentistry, I've always kept an open mind, and when I tell you that, I'm being really honest, you guys. It's it's really to me it's really hard sometimes to find someone who what I call is coachable. Coachable just means that they're always open to suggestions, and not the fake kind, like, oh yeah, yeah, oh yeah, yeah, that's cool, and then they go and they do it their way. I mean, someone who really pays attention, opens up their mind, and listens. So I want to just start off with a couple things that come up to my head when I think about bad habits, and these things come up to me because I do the ordering at my office, and for a lot of you that do the ordering at your office, I'm sure these come up also in your head, and they're a concern for you. Um, so a big one for me is unconscious supply use. So how much do we need for each procedure? Um, Knowing how much gauze, how much two by two, how much um, materials your doctor's going to use for each procedure. Do they use a cotton roll while they're prepping? Do they use a dry angle? What do they use while they're doing the procedure? Do you pay attention to that stuff so that you know and you count it? Sometimes I've walked into rooms where there's like seven cotton rolls, and we're working on like number nine. And I mean, all it tells me is the person who set up was just not thinking about what they were doing, and it tells me that they don't care to think about it. Um, I know they care that everything's there, but it's those little details that tells me if they're paying attention. Um, Supplies as far as bond. When you put out a drop of bond, how many times have you put out a drop of bond and you actually leave out a little bit more? It's fine. You can make mistakes, but when you take over for an assistant and you find the entire well full to the rim of bond or primer, I mean, you're just like, what the heck? The hell are you gonna bond with all that? I mean, it's a waste. It really is. It's a waste. Leaving the caps slightly open, so when you go back in, the whole cap and all the around the bottle is full of bond. Primers, cements, same thing with cements. Um, if you're not sure how much to use, ask ask someone who uses it all the time. If you're putting out cement for a bridge, and you're putting out enough to cement a 10 unit bridge, and it's only a 3 unit bridge, I mean, that's a lot of waste. And if no one's paying attention, that's even worse. If no one's catching you, no one's telling you nothing, that means the entire staff is just unconscious. Um, Impression material, that's a big one. I stare I stare at the assistants when they help me mix. We use a material that sets pretty freaking fast, and I used to be able to mix the putty. We like to use putty and light body, so I used to mix the putty uh, on my own, and then go in, put the light body, put the tray in. But it sets so fast now. I don't know if the manufacturer changed their formula, but it's even a slightly different color. But anyways, when they're putting out the putty, it's a and B equal mix, and they're putting out the putty, and I'm looking like, whoa, what are you gonna take a denture impression, or what are we doing? I mean, they mix so much that when they hand me the tray to put inside, or let's say we put it on a triple tray, I can't even really see where the tray is going. So sometimes I'll get it myself and I'll remove it and I'll mold it. Or you know what? The other thing I do is I'll actually put it out for them. So there's been plenty of times where I've had the opportunity to show them how to measure putty for the trays, so that the right amount gets used. Not too little and not too much. When it's too little, you don't capture the buccal, the lingual, or you don't capture enough of the opposing, or whatever. I mean, those of you that take impressions, I'm sure have found out about that. Again, disposables, cotton rolls, 2x2s. Um, there's been there's been procedures that I need 2x2s for, and there's no 2x2s. There's cotton rolls. And like, for instance, in extraction, there was 4 cotton rolls out for an extraction, no 2x2s, and I'm thinking, what the heck was going through this person's head, you know? So not only is it an incomplete setup, you're setting up whoever's going to go in, or if you're going to go in yourself, for failure. Doctor's going to say, hey, you know what? 2x2, and you're going to grab a cotton roll. We're like, it's the same material, doc. Don't worry about it. you know? So, you have to be very conscious of these little details that become bad habits. And one of the things that my doctor today told me is, I asked her about bad habits because she has a different perspective than I do. I watch myself and I watch other assistants, but as a dentist, you're in a different chair, you're in a different perspective, so you see certain things that maybe I don't. But one of the things that she told me is that assistants, they tend to not think that it's such a big deal to forget about the little details. It may be putting a new burr of her favorite one, or putting out 3 cotton rolls instead of 2 because we're gonna need 3. All those little details. Checking if there's water coming out of the high speed. Checking if the slow speed is working correctly. Just those little things. She was telling me that in her eyes is what separates a great assistant, or assistant that's on their way to be great, from an assistant that is just mediocre. And I totally agree with that. I don't know that I would have mentioned that today, actually, if I hadn't talked to her. But the other thing I wanted to mention to you guys is opening or contaminating sterilized instruments, supplies, or disposables. All that becomes bad habits. There's procedures where patients come back and we don't need a slow speed, but assistants still take it in and they open it and they have it ready. You know what? That's great. But if we're not going to use it, it's a waste. And not only is it a waste, it's solid proof that they don't know what they're doing. Because if you might say, well, you know what, just in case, or let me put all this stuff out. But in my head, what I think is happening is they're just grabbing everything they can because they're not sure exactly what they're going to use or what's going to happen. So that goes back to having a little bit of self-discipline and and getting yourself to really learn and hone in on what you need for every procedure. I know there's those times where you may need something that you don't use all the time, and it's okay. Yeah, you get up and you go grab it. But when it's something that you use on a daily basis, it's embarrassing. It happens to me still to this day. It happens to me, and yeah, it's embarrassing if you forget the barrier to the light, or to take out enough cotton rolls, or 2 by 2, all those little things. It's important, you guys. And why does this happen? I think I just mentioned it right now. It happens because we're not we're not organized in our head. So what I mean by that is, so imagine like when you set up a room, do you set it up exactly the same way every single time? Um, do you know what you need and why? If you don't know what you need, I mean, you're already failing. If you don't know why you need it, you're halfway there. Ask the doctor, why do you use this? When do you use this? How do you use this? When do you want it? Ask those questions. It's only going to add value to you. She's going to be like, I want to work with him, or I want to work with her. They know exactly what I'm thinking. Um, how many times do you have to run to the lab to complete the setup? Uh, I had a doctor a while back that would call his assistants that would forget it. Well, he would call me too, because when I first started with him, I forget everything. And he would call me a gopher, because he'd say, go for this, go for that. And I was just getting up all the time. He said, I hired you as an assistant. So if I hire you as an assistant, I don't need you to be running. Do I need to hire somebody else to go run for stuff and you assist me? He's like, I want you in the room assisting me. That's why I hired you. And I totally agree with him. If he hired me as an assistant, why am I running back and forth? I should have everything I need and assist him, because that's my position, right? Makes sense. So, it also depends on the organization of your instruments and your supplies. Like if it has no setups, like if your crown and bridge setup is like 7 packs that are in like 3 different drawers, that's tough. And I've seen it where you have to put together an entire pack just to get a prep done. Luckily, in our office, we have a universal setup for composites, bridges, crowns, whatever we're gonna do. We have one setup. That's it, and one pack of burrs. Everything is universal, so you don't have to sit there and open 10 drawers and figure out what you need. I mean, if you can't pick that up, there's something wrong with you. So your thought process needs to be organized. You know, I let me give you guys an example. Let me just go back to what I was saying about when you set up a room the same way all the time. Um, if you grab the same stuff and you walk into the room, let me just tell you what I do when I walk into a room and I'm setting up. We have a white table paper that we put out before we set up. So I put it out, I grab the setup, and I open it. I put out the topical, the anesthetic. I take out whatever I need that's in the tub, the etch, the bond. I set up the light with the barrier. I take out the cord. I put the viscostat next to it. I have a way of doing it every single time exactly the same way. And the reason is because if I do it exactly the same way every single time, I'm not going to forget anything. But if you're like, oh, let me take that. Oh, I need that. Oh, I need that too. Oh, I need that. And I need that. Let's see. What did I forget? But if you go through it in your mind, in order of the procedure, like she's going to numb first, set that up. Then she's going to prep the tooth. So set the drill up. Get the burrs. Make sure they're complete. Then after that, she's going to use a slow speed. Boom, set it up. Then she might do a buildup. All right, etch, bond, light, composite gun. Setting it up exactly the same way every single time trains your mind, and it's muscle memory, so that you don't forget anything. But if you're doing it half-ass and you're doing it, you're grabbing different things every single time and you set it up differently every single time, yeah, you're gonna keep forgetting stuff and it becomes a bad habit. It just becomes this habit of like not thinking of what you need. You just say, okay, this looks like enough shit. Let's go for it. So having an organized mind in that sense, after a while, you won't have to think about it. It just comes. Think about like when you shower. When you jump in the shower, I will bet you right now that you shower exactly the same way every single time and you don't have to think about it. What do you do first? Do you do your legs, your body, your head, your face? What do? You go for the face lotion? I mean, the face wash? I mean, everyone has their little ritual. So you should have your little ritual for everything that you do in dentistry so that it just becomes automatic. Um, I'm going to go through a list of things that could be bad habits, or maybe this. I think we just kind of went on a tandem here. So first one is leaving the tray and the sterilization. Like I guess when you're cleaning a room and you go to the lab and you're leaving the tray there instead of breaking the tray down, putting the instruments um, in the wash, and then getting rid of the trash if there's any, and then taking the plastic off the tray, throwing that away, putting the tray where it goes so it can get wiped down, or wipe it down and put it away. So what ends up happening is you get this leaning tower of trays, you know, and every time, especially if the sterilization area is in an area where patients walk by and they could see it. I mean, it does also say something about the office, and it looks bad. It just looks bad. So, putting the tray away and not looking bad, and not only for that, doing it for your other team players. If they're doing it and you're not, you're gonna get noticed, man. You're gonna get noticed, and whether it's something that you don't care about or whatever, but some people could see it as a bad habit. So, not sterilizing instruments. Um, I don't get a big chance to sterilize instruments. Sometimes I do, and I'm guilty. I sometimes I don't go for it. And my teammates, they're man, I can't tell you how much I appreciate them. They take care of a lot. They take care of a lot, and I want to tell you guys thank you. But not sterilized instruments, if you're walking around and you got a chance to do them, do them. Um, Here's another one: not being a team player. Um, I I don't know how much of a bad habit that could be, but I think with enough bad habits, that can maybe encompass not being a team player, not putting a trash bag in the trash can. So if you're taking out the trash and you don't put a trash in there, you may think you're helping halfway, but someone's gonna say, "How come you didn't put a trash bag in there?" um, Not oiling hand pieces. Oh man, that's a big one, guys. That is like one of my pet peeves, man. And you know what I do? Even if I'm in the room and I hear someone oiling the high speed, and they go and they run it, I count the seconds, and I know. And sometimes I won't tell them right away, but I'll watch them, and I'll say something later, and I'll tell them, "Hey, man, run it for 30 seconds." You know what I mean? They'll run it for like 5 seconds. They're like, "Oh, okay, I'm done." Throw it in the bag, sterilize it. No, they got to do it correct, because those things break down and it gets expensive. So the other thing I got here is not wiping goggles for the patients. I mean, how embarrassing is that, guys? To sit a patient down, and then you're like, "Here, put these on," and they're like, "For what?" "Oh, for your protection," and the light gets kind of bright, and they're going like this, and there's this big old grease marks from the last patient. Oh, dude, that is embarrassing. I can, If you wipe them down and it leaves a residue, I can explain that. I could say, hey, you know what? When we wipe them down, it leaves a residue and it dries up. I can explain that. There's no embarrassment there. But when there's a grease mark from someone's forehead on there, or eyelash crud from the last lady that wore them, that's not cool, man. Wipe those glasses down, you guys. Um, Not knowing proper terminology to explain to the DDS, not charting out what we do patients. All right, well, so yeah, that's not really a bad habit, but not knowing proper terminology, I think that falls under educating yourself, definitely educate yourself, know the proper terms. I I know with patients we don't have to use dental terms, but knowing the right words so that they understand what you're talking about. Um, Leaving patients unattended for long periods of time, that's a huge one. I that's one of my that's one of the ones I have at the top of my list, is not leaving them for a large amount of time. And if you are, try to check up on them every 5 minutes. I think I talked about this in the last, well, I forgot which one it was. I think it was Bedside Manners, a couple episodes back. I talked about not leaving people without letting them know what's going on. I think about every 5 minutes is really good checkup. 10 minutes, people start kind of like looking back, what's going on. It just depends. If they've been in the office for a long time, they know um, that you're being taken care of if you take over 10 minutes, if that's the way you are. But if they're there for the first time, I would say don't leave them no more than 5 minutes without telling them what's going on. Um, let's see. So leaving the lab dirty, that's a huge one, guys. You know, where I'm at now, the first 2 years that I was there, um, we'd wake up in the morning, get to work, and yeah, it was a mess, man. You know, I can't tell you guys enough how much of an awesome team we have now. Even if it gets a little late, we will stay, make sure instruments are done, the sterilizer's running, we're set up for the next day, rooms are clean. There's some days where we stay really late, we might leave one room dirty, but man, that is so important because you come in the morning and you feel confident that you can start off to a good morning, you know, start off to a good morning, bring patients in. So that's very important, and that could become a bad habit because I remember the first 2 years that I was there, and it was a whole different staff. Right now we have a whole different staff. I'm the only one that stayed from the last, but um, and I've been there 6 years. I'm going 6 years this month, actually. No, next month. Um, so yeah, that's a team effort. That's a bad habit for the whole freaking team. I mean, that's horrible. I mean, I'd hate to walk into that office every morning. Not labeling impressions, leaving dirty operatories. I think leaving dirty operatories, that probably applies for during the day. I mean, after the day's done too. But like I said, sometimes you have one patient that stays late, and we'll leave it for the morning. Um, oh, here's a big one: walking by objects on the floor without picking them up, assuming somebody else will. This one, um, I was I used to work for another doctor, and he was huge on that. So I always noticed that. And it's interesting because I bet you that in most offices there's this one person that it really bothers them to see stuff on the floor. And it's almost like even if they don't want to, they have to pick it up because it bothers them so much. But yeah, that's me. There's one other assistant that I know that I think it bothers them the same way. I'm gonna mention a couple bad habits, but this is a little bit um of a twist on bad habits. This is more on the psych side, mental. So there you can actually have a bad habit of having the wrong mindset. You know, thinking that someone else is gonna do something instead of doing it yourself. That could become a habit because you think it every time that you see something that has to get done, and you just think, oh, someone's gonna get it, someone's gonna get it, and you just get used to thinking that, and you don't take care of it, and that's not cool. So not seeking growth also. Um, I think people get stuck in their head that this is the end all be all, and this is as far as I'm gonna go, and they just get so used to doing and working on their daily grind, on the daily things that goes on at work, that they don't really think about to go take a class or to learn something new. So that's important, guys. That's really important. Get online, watch some videos, do whatever you got to do. Get a book, whatever. Um, I think I talked about this earlier. Letting the small things go, those little details, you know, don't lose those. Don't lose those. That's what makes a difference between you and the next assistant. Complacency, that can become a real bad habit. Is not telling yourself that you need to do something new or grow. It's just I think some people start to fall back. I'll give you a good example. There's been times where you interview somebody and they're like super excited. They're like, yeah, 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 I'm fast at this and I do that and I do this. And like the first month, they're just like super running around circles around everybody. They're excited, got a new job. And then they get complacent and they just kind of start doing the minimum, or not even that, just kind of clock in and do whatever. When someone's watching, they start moving. When someone walks in the room, they start doing something. Um, you know, Also, the other thing is having an individual mentality and not thinking as a team. Wanting to always be the hero for the individual success. You know, it most offices have a few assistants that have some good talents, but when you try to use that as a means of standing out, I personally think it can backfire. So not having the mentality of thinking as a team. Yeah, give me a sec, guys. Let's see. Let me make sure. Here we go. All right. So I got a couple questions here, guys. Hey, what's up, Orlando? Thanks for tuning in, man. Hey, Natalie. Love you. Giannina. Hi. It's the first time tuning in. Welcome. Thanks for tuning in. Every Wednesday, 8 p.m., all right? So I have Anna here also. Hey, how's it going, Anna? Thanks for tuning in. She said her biggest pet peeve, so she said, just pick it up. I think she's talking about the stuff on the carpet on the floor. So, oh, here's one. Orlando. Actually, you guys know Orlando. He was here a couple weeks ago. We were talking about specialty assistants. He says, how can you help someone break bad habits? Yeah, just give him a good slap. No, I'm kidding. I think I think holding them accountable. holding them accountable to what their responsibilities are. But before you hold them accountable, you have to let them know that that is their responsibility. I think sometimes in the office, whatever chores have to be done or responsibilities, if we just say, well, someone's going to take care of it, then really honestly, no one's responsible for it. So you can't really hold someone accountable in that sense because it's not a direct responsibility to them. It's just kind of like, well, who did this or who did that? So having a responsibility that directly is attached to them allows you to hold them accountable, and you can follow up with them, during the day or once a week. The other thing is, you have to realistically also hand out responsibilities. So if you have someone that always works with doctors and they're in the room all the time and you give them all the responsibilities, they're probably not going to get it done. If someone's on the floor all the time, and they have that availability to do it, you got to think about that too. So following up with them and giving them a feeling of ownership. This is you, this is yours. This lab, you clean it. Someone freaking puts a cup here or someone puts, stone and they don't pick it up. You have the right to go and tell them, hey, you know what? This is my lab. I keep it clean. Please keep it clean for me. You know what I mean? Because sometimes people have responsibilities and they complain that other people are messing it up for them. So if they feel that they have that ownership, they have the right, and you give them the power to go and confront the person, not insult them, not make them feel bad about it, just to say, hey, what's up, dude? Can you clean your stuff up? And I think that helps a lot. Bringing it up in front of everyone, obviously, if it's that serious, then you want to talk to them one on one, but addressing it for sure. And I think accountability is the biggest one, Orlando. And I'm sure you know that. So Janina, she says, you have to remember you can always be replaced. Yes and no. I agree. You could always be replaced with another assistant. But if you are valued and you have certain talents, they might replace the position, but they may not replace you. Meaning they may not have another Janina, but they will have another assistant. So that's why I stress all the time, you guys, no matter what I talk about, bringing value to yourself is the ultimate thing you can do. And that's why I try to explain also some of the things that you can do. And the biggest thing is deciding up here before you do it, because you can do it once or twice a day, but if you don't decide up here that you want to change or do something different, it's gonna go away. So yeah, I do agree with you on that one. She also said, "You dirty it, you clean it. Clean up after yourself." Yeah, I agree on that. I think one of the biggest things on that one is like when you take an impression and you're using alginate and there's like 3 or 4 bowls full of alginate and the spatula's full of alginate. I think people kind of frown upon that, other assistants, because when they go to use it, they have to clean it. You know what I mean? So yeah, I totally get you on that. But you also have to, and I go back again, you guys, to my team. I leave stuff behind, but I know that although I may not have, uh, they know that I didn't leave it behind sometimes on purpose so that they can do it, or because I know they're gonna do it. They have my back, so you should also feel like your coworkers have your back. If you don't get to something, hey, don't worry, I got you. Go on, go do that. I'll take care of it. That should kind of be the culture. Um, and last but not least, you guys, um, having the habit of thinking that you're not liked, because what happens is you're focusing too much on what may not be. Whatever's going on in your head, um, instead of focusing on how important you are to the team and acting like it, embracing change and growth. So even if you're not liked, if you show heart and you show hard work, maybe even you can change your situation. So let's say it is true that you're not liked and you just constantly concentrate on that. You're not going to allow yourself to advance to a different state of mind where you can learn new things or grow and get out of that category. So definitely, guys, um, I always end up talking about something that has to do with the way you think. Um, but I think it's just very important, you guys. Very, very important. So until next time, guys, that's all I got for you guys today. Thank you guys for tuning in. I really appreciate it. I want to give a shout out to my doctor, Marak Kazali. Thank you so much. I appreciate you a lot. I want to give a shout out to my coworkers, Callie and Myra and Pam. I'll see you guys tomorrow. Thank you, Silly Panda Media. Thank you, Vinyl. Thank you, The Blacksmith. I appreciate you guys so much, your time. I love you guys, man. It's so awesome. So that's it, guys. Episode 11. Don't forget to follow, share it, watch it, tag an assistant. Soon, within the next week or two, I'm going to set up my YouTube channel so you guys can watch all the videos there instead of having to go here on Facebook or whatever. You can go wherever you want. But in 2 weeks, I have Dr. Yafai, who's going to be coming in. He's an oral surgeon. We're going to have a real good conversation about surgery and specialty. He's cool. You guys will like him. So good night, you guys. Until next time, I'll see you guys next week. Peace.